Okay, this is the ratio of pounds to inches by Dr. Simeons, pounds and inches. An interesting feature of the HCG method is that regardless of how fat a patient is, the greatest circumference, abdomen or hips, as the case may be, is reduced at a constant rate, which is extraordinarily close to 1 centimeter per kilogram of weight lost. Okay, you do the math. I don't quite know what that is in pounds. At the beginning of treatment, the change in measurements is somewhat greater than this, but at the end of a course, it is almost invariably found that the girth is as many centimeters less as the number of kilograms by which the weight has been reduced. I have never seen this clear-cut relationship in patients that try to reduce by dieting alone. Well, I'll have to read that over again because I didn't totally get it. Okay, HCG comes on the market as a highly soluble powder, which is the pure substance extracted from the urine of pregnant women. Such preparations are carefully standardized, and any brand made by a reliable pharmaceutical company is probably as good as any other. The substance should be extracted from the urine and not from the placenta, and it must, of course, be of human and not of animal origin. The powder is sealed in ampules or in rubber-capped bottles in varying amounts, which are stated in IUs. In this form, HCG is stable. However, only such preparations should be used that have the date of manufacture and the date of expiry clearly stated on the label or package. A suitable solvent is always supplied in a separate ampule in the same package. Once HCG is in solution, it is far less stable. It may be kept at room temperature for 2 to 3 days, but if the solution must be kept longer, it should always be refrigerated. When treating only 1 or 2 cases simultaneously, vials containing a small number of units, say 1,000 IUs, should be used. The 10 cc of solvent, which is supplied by the manufacturer, is injected into the rubber-capped bottle containing the HCG, and the powder must dissolve instantly. Of this solution, 1.25 cc's are withdrawn for each injection. One such bottle of 1,000 IU therefore furnishes 8 injections. When more than one patient is being treated, they should not each have their own bottle, but rather all be injected from the same vial and a fresh solution made when this is empty. As we are usually treating a fair number of patients at the same time, we prefer to use vials containing 5,000 units. With these, the manufacturers also supplied 10 cc's of solvent. Of such a solution, 0.25 cc contained the 125 IU, which is the standard dose for all cases and which should never be exceeded. This small amount is awkward to handle accurately. It requires an insulin syringe and is wasteful because there is a loss of solution in the nozzle of the syringe and in the needle. We therefore prefer a higher dilution, which we prepare in the following way. This is why Mama Clock does it the way she does it. I'm having a hot flash. The solvent supplied is injected into the rubber-capped bottle containing the 5,000 IU. As these bottles are too small to hold more solvent, we withdraw 5 cc's, inject it into an empty rubber-capped bottle, and add 5 cc's of normal saline to each bottle. This gives us 10 cc's of solution in each bottle, and of this solution, 0.5 cc contains 125 IU. This amount is convenient to inject with an ordinary syringe. Injecting. HCG produces little or no tissue reaction. It is completely painless, and in the many thousands of injections we have given, we have never seen an inflammatory or suppurative reaction at the site of the injection. One should avoid leaving a vacuum in the bottle after preparing the solution or after withdrawal of the amount required for the injections, as otherwise alcohol used for sterilizing, a frequently perforated rubber cap might be drawn into the solution. When sharp needles are used, it sometimes happens that a little bit of rubber is punched out of the rubber cap and can be seen as a small black speck floating in the solution. As these bits of rubber are heavier than the solution, they rapidly settle out, and it is thus easy to avoid drawing them into the syringe. We use very fine needles that are 2 inches long and inject deep intraglutally in the outer upper quadrant of the buttocks. The injection should, if possible, not be given into the superficial fat layers, which in very obese patients must be compressed so as to enable the needle to reach the muscle. It is also important that the daily injection should be given at intervals as close to 24 hours as possible. Any attempt to economize in time by giving larger doses at longer intervals is doomed to produce less satisfactory results. There are hardly any contradictions to the HCG method. Treatment can be continued in the presence of abscesses, suppuration, large infected wounds, and major fractures. Surgery and general anesthesia are no reason to stop, and we have given treatment during a severe attack of malaria. Acne or boils are no contradiction. The former usually clears up, and furunculosis comes to an end. I don't know what that is. Thrombophlebitis is no contradiction, and we have treated several obese patients with HCG and the 500-calorie diet while suffering from this condition. Our impression has been that in obese patients, the phlebitis does rather better and certainly no worse than under the usual treatment alone. This also applies to patients suffering from various ulcers, which tend to heal rapidly. Fibroids. While uterine fibroids seem to be in no way affected by HCG in the doses we use, we have found that very large, externally palpable uterine myomas are apt to give trouble. We are convinced that this is entirely due to the rather sudden disappearance of fat from the pelvic bed upon which they rest, and that it is the weight of the tumor pressing on the underlying tissues which accounts for the discomfort or pain which may arise during treatment. While we disregard even fair-sized or multiple myomas, we insist that very large ones be operated before treatment. We have had patients present themselves for reducing fat from their abdomen who showed no signs of obesity but had a large abdominal tumor. I wonder if that's my problem. Doubt it. Gallstones. Small stones in the gallbladder may, in patients who have recently had typical colics, cause more frequent colics under treatment with HCG. This may be due to the almost complete absence of fat from the diet, which prevents the normal emptying of the gallbladder. Before undertaking treatment, we explain to such patients that there is a risk of more frequent and possible severe symptoms and that it may become necessary to operate. If they are prepared to take this risk and provided they agree to undergo an operation if we consider this imperative, we proceed with treatment, as after weight reduction with HCG, the operative risk is considerably reduced in an obese patient. In such cases, we always give a drug which stimulates the flow of bile, and in the majority of cases, nothing untoward happens. On the other hand, we have looked for and not found any evidence to suggest that the HCG treatment leads to the formation of gallstones, as pregnancy sometimes does. The heart. Disorders of the heart are not, as a rule, contradictions. I think contradictions means it messes with current medications or whatever. I'm not quite sure. Look it up in the dictionary or Wikipedia. CONTRAINDICATIONS. In fact, the removal of abnormal fat, particularly from the heart muscle and from the surrounding of the coronary arteries, can only be beneficial in cases of myocardial weakness, and many such patients are referred to us by cardiologists. Within the first week of treatment, all patients, not only heart cases, remark that they have lost much of their breathlessness. Coronary occlusion. In obese patients who have recently survived a coronary occlusion, we adopt the following procedure in collaboration with the cardiologist. We wait until no further electrocardiographic changes have occurred for a period of 3 months. Routine treatment is then started under careful control, and it is usual to find a further electrocardiographic improvement of a condition which was previously stationary. In the thousands of cases we have treated, we have not once seen any sort of coronary incident occur during or shortly after treatment. The same applies to cerebral vascular accidents. Nor have we ever seen a case of thrombosis of any sort develop during treatment, even though a high blood pressure is rapidly lowered. In this respect, too, the HCG treatment resembles pregnancy. Okay, I'm going to stop here, and I think I only have one more chapter to go. This next one is going to be teeth and vitamins. See ya. Why is it getting so dang dark?